At first, we put the celluloid bond between the teeth to prevent the contamination of the adjacent tooth with the acid edge or bond. Then we put the acid edge. If we suppose that this all is enamel, we will put acid edge on the area. If there is enamel and dentine, we first put on the enamel like this. This is gel one for 5 seconds, and then extra 15 seconds for dentine. Okay, we leave it for how much? For how much time? 20 for enamel, 15 for dentine. Then, after the time is finished, we wash it and dry it. For the dentine, it should be moist. For the enamel, it should be clearly dried with a whitish discoloration, يعني whitish color. If this white color is not appearing, the solution is putting the, or there is a contamination by saliva or blood or anything else, we will put acid edge for extra 10 seconds and then wash it, okay? After you finish this step, you will put the bond. The bond will be put by brushes, okay? Then we use the brush and put the bonding, insert the bonding on the tooth. As we said, it's better for 10 seconds to remain on the tooth for 30 seconds, and it's better if you rub it on the tooth so it will more effectively go inside the dentinal tubules and micro porosities that is created by the enamel. After you insert the bond, you will dry it for how many seconds? 5 seconds, gentle air, like this, to spread it inside the porosities, and then evaporate the monomer, extra monomer, and then you do curing. And the curing, you open the device. You will leave it for 20 seconds. It has a timer and will beep at each 5 seconds. It's better to use this shield because it's dangerous for your eyes. After that, you will start the insertion of composite. If it is a natural tooth, you should do color matching, but because this is a synthetic, you cannot do that. You cannot obtain the same color. But this is, as you see, so dark for this teeth. We will try if there is a color that can be closer to it. It is better not to use the light because it will distract you. It's difficult to have the same color with these synthetic teeth. So we will have a little composite out and divide it to increments so we can use it easily. each increments 1 to 2 millimeter only, to be more controllable of your work. You will help because it is class 4, so labially and palatally don't have enamel. So how will you apply it? First, you will hold the celluloid bond by the tip of your finger like this and try to have a palatal enamel at first and try to adapt it and mimic the adjacent tooth. As you know, because this is the mesial side, it should be sharp angle, yani almost right angle, not curved like the distal side. So which side you are working on, you try to mimic it, okay? After we make the palatal side, we will put the light cure on it for 40 seconds. We have materials that need only 20 seconds, or bulk fill that needs, you can use more than 2 millimeter, you can use till 4 millimeter and insert it and cure it at once. So according to the manufacturer instruction, you will do your curing. Okay. When we finish it, it's like this. Okay. Did you see it all? Okay. Then we insert the other layer. It is a big one. Okay. We'll try to condense it and have the same shape. You will do this because you put another increment and it will make your contour. It's better if the light cure is started with a soft start and then increasing in the intensity. You will reduce the C factor by this way. Okay. Now, I will try to see if there is any defects, if there is anything more I want. Here, it's okay, but here I have deficiency. So I put more composite and try to adapt it. Like this, you hold it tightly and you put the light cure on it. Okay. Now it's finished. Okay. What's the next step? Is contouring, finishing and polishing. Okay. Now you need light. A slight touch. Just to remove the excess. And be careful not to remove the tooth structure. Here we have the tooth. If you see, here we have two curves, one like this and one like this. So here, when you do contouring and finishing, you should be careful about that to follow the anatomy, the normal anatomy. Because we were careful when working, so there is no much extra to contour and finish. So this will buy you time and also make your patient more comfortable, okay? These are finishing strips, okay? As we see, this is a shiny side. This is abrasive side. So this side that you don't want to do anything to it, it will faced by the shiny side, okay? Now like this, I will enter it inside the teeth and try to do what? To do polishing, okay? Okay. So by this way, you will be sure that there will be no any overhang or any irregularities that may cause any problem in the future, okay? After that, we have, as we have in the lecture, polishing rubber cups and others, many types, but we don't have it here, so we can't use it. We can use this side also, but it's not scientific. It's finished, okay? We have also abrasive paste that we can use with the rubber cup, but we don't have it here in the lab, so this is what we can do. Can you see the color match is not perfect, but you cannot tell the line of it thanks to beveling. So beveling is very important in the anterior teeth. Don't forget that, okay? Anyone has any question? Yeah.